Good morning. We are back out at Academic Alliance in Dermatology. Today we are joining you from one of their 15 locations, the Clearwater office. I am joined now with Dr. Zook. How are you today?
I'm doing fine. Thanks for asking.
Such a pleasure to be out here today. And today we're going to talk a little bit more. We've talked a lot with your team to really find out how you guys are ahead of the game, certainly when it comes to dermatology. But let's talk about the academic kind of portion of this business and the offices, because I want you to brag on yourself, Dr. Zook, because this really is kind of, you guys are ahead of the game and ahead of the curve, I think, when it comes to skincare. Talk about how you guys are able to pull that off.
Well, we are kind of proud, I think, of our pedigree. We're proud of our results. Of the physicians that we have, there's several, including myself, who have graduate degrees as well, MD, PhDs, which entails a little bit extra schooling and that kind of thing. And so we're proud of that. We also have a relatively systematic approach to how we deal with patients, how we look at patients in the room, you know, the kind of things that we look for. We get together on a monthly basis and go over tough cases, go over difficult cases, and kind of put our heads together, which is something that not a lot of offices are able to do or have the time to do. But it does provide a lot of valuable input for us in terms of, you know, getting some other points of view, getting some other options and things like that. So it's one of the unique things I think that we're able to do. So it's things like that where we go the extra step, I think, that enables to kind of to be a step above and a step a little bit above where everybody else is.
Talk about even clinical trials, because I believe you guys are doing, you and your team are doing those as well, which is, I think, pretty unique.
Yeah, we do. There's a separate entity that's associated with Academic Alliance. It's called Olympian Clinical Research, and it functions out of this office here in Clearwater, as well as our Tampa office, and soon will be functioning in the Largo office as well. It involves myself and 3 of my colleagues who will see patients for clinical trials. And for those who don't know, clinical trials are set up by manufacturers of medicines, and they're regulated by the FDA. And basically what they involve is they ask the question, does this medicine work? Is it safe? Does it do what we expect it to do? And that's what those studies entail. So we recruit patients and collect data on them. And it's a little bit unique in that not a lot of dermatology offices are doing it. Some of the advantages, I think, for the patients are that, one, you get potential access to some of the latest and greatest therapies out there, because these are cutting edge, kind of latest and greatest products that are available. Number 2, you get a level of care that you probably wouldn't see just in the general clinic. You get looked at a lot, you come in a lot, and they pay a lot of attention to you. There's blood work and those kinds of things. So the level of care is a little bit different as well, which is kind of nice. And then number 3, it's all for free. It's not run through insurance. There's no cost issues, that kind of thing. So it's a nice issue for some people in that regards as well.
You also have labs here, which I think is so crucial. Talk a little bit about Mohs Surgery and how important that is when it comes to treating skin cancer, and why that specialty it really is important.
Sure. Yeah, so Mohs Surgery is a surgical technique which has become a little bit more popular in the last couple of years for very good reasons. One, it's a very powerful technique. It's useful for certain types of cancers, particularly head and neck or other areas with certain criteria. What it involves is removing a small piece of tissue where it appears as the cancer is, and then checking it in the laboratory to see if all the cancer cells are out. If it looks like...
You do that right here.
We do that right here, right, in real time, which is kind of nice for the patient. So it does 2 things. One, it gives us the highest cure rate in a lot of cases. We don't let you leave until we're sure that we got all the cancer out. And number 2, we take what we need and nothing extra. And so the wound, the scarring, hopefully is minimized in that regards as well. So the cosmetic effect hopefully is a lot better as well.
Anything else as we wrap up here that you think we should mention? Because I really do want to make sure people know how you guys are really kind of setting yourself apart from other dermatology offices out there.
Yeah. I think one of the things that I myself try to do, and I know Dr. Vasiludis, who's the owner of the practice, would agree as well, is we try to make sure we go above and beyond for the patient. You know, if you have a problem and you need to be seen that day, we'll really try to get you in if there's availability, whether it's here at another office. If we need to talk to other doctors and put our heads together, like I said before, we'll do that kind of thing for you. And I think that kind of level of care hopefully is what comes through to the patients and makes it a little bit easier for them. Hopefully that's just something that they get here that they might not be able to get somewhere else.
Yeah. So. Well, again, just about 15 locations now, I believe. You're always adding more, but here in the Bay Area. So like you said, if you do have questions, make sure to give them a call. Doctor, thank you so much. We know you're very busy. We appreciate your time today.
Oh, my pleasure. Thanks for coming.